say, hey, we've got a new episode on Healthcare Growth Cycle podcast. This is episode 3. So Ali, I appreciate you being one of kind of the founding, I'll consider you like a founding guest on the Healthcare Growth Cycle podcast. But really, really excited to have you on. Ali is the founder and CEO of Telecare, telehealth solution, and we can get into it more, of course, but a telehealth solution that specifically helps for patients that have been in car accidents. And so I'd love to learn more about that. But first, Ali, I'll just kind of give you the floor a little bit. If you want to introduce yourself, give some background on your career and how you ended up getting into health tech and telehealth, that'd be really, really helpful for the listeners.
Absolutely. Well, thank you so much, Kristen, for having me here. And it's actually an honor to be a founder of those episodes just in the beginning. Just a little bit about myself in the beginning. I've been a doctor of physical therapist for the past 18 years. And moving forward, actually, telehealth and telecare started not just from the technology part, started actually from the treatment room. I found a need for those patients, for that specific patients that we will talk about later, that they need some kind of access, easy access for them to receive the care that they need. A little bit about my background. I used to be a rehab director for a traumatic brain injury inpatient hospital for about 6 years. I used to see like a really big catastrophic cases of traumatic brain injury patients. Patients would transfer from the ER, and then they would spend with us about 6 to 8 weeks of rehab between speech language pathology, occupational therapy, physical therapy, mental health counseling. They would spend that time 6 to 8 weeks before they actually get back either to their homes. Some of them would be transferred to a nursing home or an assisted living if they haven't really reached a certain independent level for their condition.
Sure.
So back in 2017, I started my outpatient physical therapy clinics down here in Georgia. We have multiple locations. It's called Unique Care. And we do a lot of work when it comes to like manual therapy, hands-on treatments, dry needling, cupping, spinal manipulation, different things for patients who's coming in with pain, post-op, car accidents. And I would say over the past few years, we've been growing so much into the personal injury space, which patients comes as a no-fault injuries. It could be a slip and fall, it could be a car accident, it could be a dog bite. And I started to notice like a lot of those patients that comes in the clinic physically to receive some physical therapy, they still receiving or they still experiencing some concussion symptoms, dizziness, anxiety, depression, PTSDs. And with my background, I'm a certified traumatic brain injury specialist. I'm a certified vestibular concussion specialist. So I have a lot of experience in the TBI based on my career. I wanted to do something just specifically to those patients who are still suffering from concussion. And unfortunately, a lot of those patients, they don't know that they have concussion. Maybe they did some kind of diagnosis through the ER or they saw a neurologist and they got diagnosed with concussion, but then there is no actual treatment after those kind of diagnoses. And that's when I started to say like, okay, let's actually implement some of those concussion treatments in the outpatient facility. But it didn't work. And it didn't work because of the patient's symptoms. Patients have dizziness. They can't drive their car. They are scared to be in the car again. They have memory issues. They forget about their appointments. And that's when the telehealth started. That's when the whole tech part for those patients, how I can actually deliver such a very specialized services for those specific patients from the comfort of their home. And my mission from the beginning was, okay, I used to do those kind of rehab for an inpatient facility, but for much more catastrophic cases. Yes, concussion considered as a mild traumatic brain injury, but the patients still have some significant symptoms. So I wanted to apply the same rehab concept, but in a virtual platform. So that's when I started Telecare about 2 years ago. We actually just had our 2 years anniversary last Friday. We had a big conference down here in Atlanta.
Congrats.
And thank you. And we always wanted to be able to have those patients to have access to the different type of rehab from the comfort of their home, which become very, very successful for those patients to get treated.
Yeah. So just to wind back to the being a director at a rehab clinic,
Yes.
I'd read too, just through your LinkedIn, that you were responsible for a lot of the growth there. And since this is the Healthcare Growth Cycle podcast, I also want to mention to the listeners, like Ali, you have a tremendous amount of background in not only practitioner
Yes.
level experience, but then the actual business administration, healthcare administration side of it. You're
Yes.
credentialed in both,
Yes.
which I think makes you super unique as a CEO to actually have that hands-on clinical experience as well as blending the business. So I'm just curious to learn a little bit more, dive a little bit deeper into how you grew that trauma brain center clinic that you worked at as a director.
Absolutely. Well, so I joined that traumatic brain injury inpatient rehab. So it's not an outpatient; it's an inpatient where patients comes in and they actually stay there for a whole 6 to 8 weeks. So
Okay.
it's kind of like an inpatient hospital. So I joined 2012, and that unit at this time we started with 2 patients that were there. 2012. I stayed there until 2018, but by 2014, which was 3 years after I joined, we had a full house of traumatic brain injury in that facility. And at this time, I was able to actually get the CARF certification for that facility, which is a very high standard of certification for specific inpatient facilities to have,
Okay.
which gives you much more accreditation for how you do your work, how you do your admission, how you treat your patients. Uh, it it handles every aspect of it, even the food that they get, the nutrition that they receive, everything when it comes to managing a great successful journey for the patients before they get discharged. A little bit of a background: I have a master's in healthcare administration and management from Colorado State University. And as a physical therapist, I see that it's very important as a provider to actually know the business side of what you're doing,
Sure.
because you can't just be a clinician. To me, dealing with patients is exactly the same like you deal with any other clients in any other business. You need to know how to work with your patients. You need to know how to sell your services to the patients. You need to know what's your strengths. You could be a great clinician, but you don't get to the point where you can make those patients trust you enough to come back and see you every time for treatment. So being on the business side is very important to grow anything. It doesn't have to be just only clinical work, but specifically working with patients. Unfortunately, a lot of other physical therapists, they think that if I can just treat the patients very well, that's all what I need to do. I don't think that's enough. Yes, you should treat the patients. I have tons of certifications when it comes to manual therapy treatments. Like I'm a certified McKinsey therapist,
Wow.
Mulligan's therapist, Syriax therapist. I have my spinal manipulation certification. So I'm since for the past 18 years, every single year, I get myself certified in a specific clinical work. Now, let me share with you something also when it comes to
Sure.
business and clinical work. With my outpatient physical therapy clinics, I have different locations, and we always hire providers, physical therapists that most of the time they would come in from some other different physical therapy clinics, right? And unfortunately, a lot of our business out there, there is not so much highly qualified clinics that would actually focus so much on how much quality of work that the patient would receive from their physical therapist.
Okay.
And for me, I created a unique care certification, which is a 50 hours hands-on training for any provider who would join our company coming from any other company, or even if it's a fresh grad provider. And there are reasons for that. I wanted to make sure that there's a standard of care. So any patient that would go to any specific clinic anywhere, they would receive the same quality of work that they would receive in any of our other clinics, right? Second, you have to have not just a standard of care, you have to have a protocol of treatment. Yes, every provider would prefer doing something different, but at least you have to have some certain protocol that the providers would follow to make sure that these protocols would work perfectly with these type of patients. So
Okay.
if you don't know the business side, if you don't know your competition out there, if you don't know your strengths, because if my strengths to compete with some other people who's having like 200, 300 clinics out there, my strength is I'm sure that I'm going to provide such a higher quality than anyone else. So if you lose your niche as being one of the best people that provide this high quality services,
Yeah.
then you can't really compete with this 300 clinics out there.
Yeah. So what kind of quality protocols are you referring to? And furthermore, did that inspire the launch of Telecare with the quality protocols that you're talking about here?
Absolutely. To me, um, you have to provide something unique and something specialized. The more you have a niche, the more you do something then that you do it better than anyone else, that's when the people would like to come to you. People would drive 30 minutes, 1 hour to come and see you because they know that you're going to provide the best quality of services that you can. So, in a typical world, for a corporate physical therapy clinics, most of those clinics have like an open gym area where patients would come in doing the same exercises over and over and over every time they come in. There is no such a customized services for that specific patient to receive.
Got it.
Also, if I have a patient that comes in to me with 9 out of 10 pain, for example, knee pain, if I take that patient and put them on a treadmill and put them on a bike and they're still having the same pain and it's severe pain, the patients wouldn't come back to me because they come to me, I put them in more pain because I'm not really addressing where the problem is coming from. What's different from what we do is we have private rooms where the patients would get in one-on-one with their provider. They will get tested and then they will get the manual therapy that they need from so many different techniques that we are certified in. So once I get your pain level from 9 out of 10 to 2 or 3 out of 10, then I can engage you on so many different other exercises that would be very doable for the patients to do. And that's what build that link between you and the patient. The patient feels better because you address their problem, you customize their care, and you lower down their pain level to the point that they can actually get back to their exercise routine as they used to be.
Wow.
And applying this through Unique Care, my outpatient clinics, for the past 9 years, pretty much, that's always my goal is how I can get to the point where I'm providing the best quality of care all the way. And that actually the same concept, how we applying it with telecare. Telecare is very specialized niche of treatment that I would say we are one of the only company nationwide that provide these kind of services as a rehab protocol. There are
Oh,
some other companies that would do the mental health components. Some other companies will do the cognitive components. But my protocol coming from the inpatient rehab is to be able to provide like a whole rehab concept, but in a virtual platform.
sure. Yeah.
Yes,
So let's pivot to the platform itself.
sure.
Is it application that patients log into? Does it embed itself into something that hospital or partner hospital system provides? Like what does that all look like?
Sure. So I use a specific EMR for my outpatient physical therapy clinics, right? This is an EMR where we enter we document the session, we say what the patients did, everything, like, the treatments, protocol, and everything. But when I started Telecare, since it's a complete virtual company, I have to find another software where it could be compatible to do the documentation, the billing, the EMR, but also to be able to see the patient's virtual on that specific platform. And that EMR was also able to send texting to the patients, reminders, emails. You can do mass email campaigns to the patients if you have some specific announcement that you wanted to do. So I think that's part of the technical part or the technology part
Yeah,
of you handling like an outpatient physical therapy clinics versus you handling like a virtual company, because you have to find something that's easy for the patients to use. Yes, it's a software, an EMR software, but also the patients download the application on their phone. So they have access to their visits, their previous visits. They have access to their notes, their documentation. They can actually request a treatment session. They can cancel a treatment session. They can text us back. So it's so much easier for the patients. It's a very friendly user for those patients to use.
Sure.
compared to the other software that we're still using for the outpatient physical therapy.
Interesting. Interesting. Um, can you go into just the overall journey of founding a health tech company? Like, what has that been like? So you've been in business now for 2 years, I think you said at the beginning,
For Telecare, yes.
for Telecare. Yeah. So what has
Yes.
that journey been like?
Great. Let me give you a little bit of an interesting story of how it actually started, right? So it's been in my mind about 3 years ago, as I mentioned, like with the patients that I see with their symptoms and why we're not doing something for concussion and why we're not treating those patients until I was in a conference, and the conference was for completely something different, right? But for some reason, I had this little notebook with me, and that conference was on a Thursday. And I started to actually write down some vision of how those concussion patients should get treated. So basically, telecare started from treatment room, from the experience of what the needs of those patients has to be and how we can fulfill those needs. So Thursday, by the end of the conference, I had like almost 20 pages of how I think telecare should work. It started first as, okay, I'm going to see the patients in the outpatient clinics. I have the clinics already. I have the database. I have the staff. So I'm just going to get the patients to come in my outpatient. But patients has symptoms. Patients wouldn't show up. Patients are scared. Patients has some memory issues. So I start to write down, okay, it could be virtual. So how I can do hiring, how I can access nationwide patients in every state. From Thursday all the way until Sunday, I almost slept 2 hours every day through this weekend. Just putting ideas just to, because once you start, you can't stop until you just finish it up, right?
Yeah.
By Monday morning, I was actually printing down the brochure for Telecare
Wow.
and registered the company, and it, because it was always there. It just, you
Burst of
wanted that,
action. Yeah.
yeah, you
I
just
love
wanted
that.
that time that you say, man, I just wanted to execute it. And once you start streaming it on paper or on a whiteboard, that's when you can see the whole thing. And of course, it evolved over the years. We did a lot of optimization. We did a lot of great work over the years, but just to implement that idea, you needed some space, some time. My wife didn't talk to me. My kids didn't talk to me for the whole weekend until I just, okay, by Monday, now I have a whole vision of what and how I wanted to do this company and how I wanted to run it. So
Wow.
I reached out to one of my speech language pathologist friend that she used to work with me. She was one of my team at the TBI facility 12 years ago. And
Wow.
I met her on Tuesday right away. I proposed to her what I'm trying to do. I need you as a rehab director. Now, they always say when you handle your second business, it's way more successful start than your first business, right?
That's good
Because
to hear. No.
yes.
As I'm going through my first business right now. Not,
At least from my experience. But that's true. That's
yeah.
true because, for example, with Unique Care, I was always working in the business, not on the business, right? Because it's still your baby. You just want it to be there. You want it to be there for every patient. At some point back in 2017, when I started my outpatient, I was going out for marketing. I would come back in the clinic to treat patients. I would clean the office. I would answer the phone.
Wow.
So you were just all invested in the business, right? Now, when we started Telecare, I know what I wanted to do. I know how I wanted the foundation to be, how I wanted to create my management team, how I wanted to have a case management department, intake department, rehab department, marketing department. And I started to put all these together. And guess what? That was July of 2023. August of 2023, that's when we had our first patient. Um,
Wow.
and it took us like a couple months, 3 months in 2023 to get things started. 2024, and by the way, in that same notebook that I was talking to you about, that I was writing notes, I put my vision for the company over the next 3 years. We met this goal the first year, 2024. We are about to hit this goal in 2025 for the second
Wow.
year. And now we're working on setting up this goal for next year of 2026.
Amazing.
Thank you. Thank you.
Yeah. That's incredible. From a future looking standpoint into 2026 and beyond, I have to ask this question. I'm a data guy, right? Everyone's talking
Sure.
about AI in
Yes.
telehealth. Like what are your thoughts? Where do you see AI as a big opportunity, specifically in telehealth or just in physical therapy in general? I'd love to hear your insights on it.
Absolutely. So there is different components when we look at the company. There is different components of the company. There is rehab working directly with patients, and that's what we use EMR, the one I mentioned to you that does everything related to the patient's treatment. We have the management software where our case managements, our management team works on. That's how we are able to track everything,
Okay.
the referral date, the conversion data, how many referrals we received for 1 month, and what's our conversion rate for that specific month. How is the, like, for example, if you ask me how long is your treatment protocol would go, if you have a patient that gets treated with you, we have a specific data to track when the patient start date was and when was the discharge date. So it's not just we throwing numbers. We know exactly what's our average for how long the treatment would go, how long the case would take, because we work on personal
Wow.
injury cases. We know what's our conversion rate is. So my point is, so we have a software for the treatment. We have another software for the case management, right?
Sure.
These two tools, if we're not using AI with them, we're already so much behind.
Wow.
So we've been already using AI tools, specifically started with the case management work. So that's how we are able to track data. This is how we can create automation. So for example, we work with attorneys, for example, we work with medical providers. So it's not just only us working, we work with neurologists, we work with attorneys. So we have an automated system where it says, okay, when the patient comes in today, the provider, the neurologist need to know that we are treating the patients and the patient started. The attorney needs to be informed that this is what's going on. This is, how the treatment is going, just to give them an
Okay.
update of what's going on. So automation and AI is a huge part in our software that we use for case management and for management in general.
Okay. Yeah. Just from
Sure.
a business lens, I should have asked this first too, just fundamentally. How do you get patients onto Telecare? Is it through referrals with other providers, like other physical
Yes.
therapy practices? Like how do you have like a partnership with those hospital systems and providers, or like how does that work?
Yes, we do. So
Okay,
we partner with providers like neurologists, orthopedists, pain management clinics. A lot of those providers would screen for concussion, or at least knowing that the patient has concussion symptoms or TBI, and those would refer those patients to us because they know we're gonna assess the patients, we're gonna do our evaluation, and then we're gonna go ahead and start the treatment with the patient right away.
awesome.
So we do a lot of we do a lot of events, like awareness events, as like the conference that we just had last Friday, and those are the best way of me marketing for my own company, because
Wow. Yeah.
concussion is such a diagnosis that's very I would say, like, missed in a way that not a lot of people knows how to actually know that this patient has a concussion or not. Even like normal
Wow.
population, you might get like, or someone might get to fall and they get up and they suffer for a few days or few weeks from headaches, dizziness, and they think it's just okay. It's
Just
just gonna go away on its own, right? Um,
oof. Yeah.
so so yes, we do a lot of like awareness events, we do a lot of conferences, we do a lot of
Wow.
like lunch and learns, and we try to educate people as much as we can to tell them, hey, if you see those symptoms, please try to direct those patients to the right, place to get treated and get better.
Yeah, do you now I think outside of like provider referrals, you can also just go direct, right? Like you could market to patients directly. Do you do that or is it
Yes.
me? Okay, gotcha.
Yes,
Yeah,
we do for patients, for like, just regular people if they have something.
yeah,
But I will give you an example. Like for my
sh-
outpatient physical therapy clinics, it's we do a lot of B2C and B2B marketing, right? Because it's easy for patients who's having neck pain to go and do a search and say neck pain treatments near me, for example, right? The problem with telecare or with concussion is the patient themselves many times they don't know that this symptoms related to the concussion.
Right.
And that's why we see more patients coming from the B2B versus B2C, because
Interesting.
now they went to an orthopedic doctor and the doctor saw them for their shoulder, for their neck, but then at the same time they checked on their head, and that's when they start saying their symptoms, and that's when the doctor say, okay, this is a concussion symptoms. Let me get you somewhere where they can really take care of your symptoms.
Makes a lot of sense. Yeah.
Yes, yeah.
I know I probably wouldn't be aware, and I'd probably just assume that I have just like a bad migraine or something. Oh, I'm
Exactly, and
looking
it's
at my
just gonna
screen
go
too
away.
long. Yeah. Yeah. Meanwhile, maybe I was at the gym and a dumbbell clunked me on the head or
Right?
something. No, I hope not. I'm just kidding. Man.
Yes, yes.
Yeah. No,
But
super.
now,
I mean, so yeah, I mean, playing the B2B and the B2C space, that's
exactly.
wild. I mean, because like me as a consultant, it's
It's
mainly just B2B and
B2B
yeah,
mainly.
sure, I'm selling myself direct, but it's still just interfacing with other business. You have the patient and have to get inside not only a hospital system or a partner's head, but also an actual
Normal
patient
population.
and
Exactly.
understand. Yeah, that's intense. I love
Now,
too that. Oh yeah, go ahead.
no, sorry, I just wanted to say, like, just
Yeah.
completing that point. So we talked about two different softwares. So the management software, we use the AI so much for data, for automation, for metrics. We do that a lot. But
Okay.
also when it comes to the EMR itself, they made it so much easier now with using AI for documentation purposes, which makes it so much more efficient for the provider to lessen the time of documentation for them.
Okay.
Because if you are in the medical field space, you would know that documentation is always a nightmare for every single provider. So it would lessen the time that they would actually use to do the documentation, but also it makes the treatment much more efficient, because now you have 100% focus on what you wanted to do with the patients versus you have to keep distracting yourself and doing notes. Yes, you still have to do notes. AI is not doing anything. AI works on the prompt that you actually give it to them based on your evaluation, right? But at least it kind of make it more efficient for them to use more time to treat the patients versus more time to actually do the documentation.
Yeah. Yeah, and I've heard what is it like scribing tools, right? Maybe that's what you were
Yes,
describing.
yes, yes,
But that you actually like it's able to listen to provider
exactly,
patient interaction. Yeah.
exactly.
Fascinating. What kind of so SaaS, right? Telehealth. What kind of metrics do you typically look at? This is just one of the informal questions here that I have listed as something to touch on. What kind of growth metrics do you focus on as far as the business finance revenue side of the house?
Of course. So we always, there are metrics that you use and look at to look at how your business is doing, right? And there is also some metrics that you do to see how we are efficient with our patients retention, right? Because again, yes, it's, and that's the tricky part. It's business, but we're still working with patients, and those patients need us to help them with their treatment. So we always wanted to make sure that we are providing the best quality of services, and there is a specific metrics that you can look at to see if it's actually efficient or not. So for example, I look at metrics of patients retention and providers productivity, right? So if I have a provider that has a pattern of seeing patient for an initial evaluation and then a second visit, and then there's a pattern that these patients don't come back to see the provider every time they see an initial evaluation, right? That tells me that this provider is not really providing enough information to the patient that makes the patients trust that provider enough to come back and see them,
Wow.
right? But
Mm-hmm.
if I have a provider that has a good productivity in a sense of patient comes back to them, they have a consistent schedule. I look at their notes and the notes are completely consistent. Patients is making progress. That's someone that we can say like this provider has a good productivity, and that's one of the most important metrics that we look at, right?
Wow.
So we have metrics, as I mentioned, we have different departments. So let's put this under the rehab category. These are the metrics that we look at. What's the productivity per provider, and how their patients retentions are, and what's the outcome results? How many patients were discharged with 90 or 100% return back to normal functional activities, right?
Yeah.
The intake
Wow.
department, that's one of our departments as well. We look at metrics now, it's completely business. It has nothing to do with patients care. But we look at metrics of conversion rate. Like, okay, we received 1,000 referrals, for example. Out of those 1,000 referrals, we were able to convert to a new patients 85%. All right. What was our percentage in the first quarter versus the second versus the third quarter? Are we going up or are we going down? That would tell you, okay, are we efficient enough? Do we need to hire more staff? Are we understaffed? Are we overstaffed? So it gives you an idea of how your intake department is doing as far as conversion rate.
Sure.
Not just only conversion rate, but also we with telehealth, one of the great things that we almost promote is that we can see the patients as fast as we can because we have a lot of providers. They can get access anywhere, anytime. We since we are nationwide, we have time zones which pretty much would cover patients anytime from 7 a.m. to 10 p.m.
Wow.
Depends on their time zone.
Yeah.
So we have a leverage of scheduling those patients the second day within 48 hours. So that's something that we look at the intake department to see when was the average days from once we received the referral until the patient scheduled and until the patient was seen for the first appointment,
Wow.
right? Because
Yep.
that's something that we also promise people that we work with, like, hey, we will try to get the patients within 48 hours to start their initial evaluation. And that's something that we always look at when it
Yeah.
comes to metrics itself.
Does it usually
Mhm.
in person, would that
Sure.
take a lot longer typically on average from
Yes. Yes.
yeah, okay.
Because think about it, like if a patient work from 8 till 5, all right. Yes, in the outpatient we have slots open until 7 p.m. But it's not a big space only from 5 to 7 to get as many patients as you want it for for that time frame. But with telehealth, we work, as I said, until 10 p.m. So patients who were not able to come in the clinic
It's just
at 4 or at 5 or at 3, now you can get them at 6, at 7, and you
yeah,
will see them from home as well. So they don't have to drive somewhere
they're
else to be treated.
comfortable. Yeah.
Exactly, yes. Yes.
That's great, Ali. Well, I know so we're right around the 30-minute mark here, and I like to keep
Sure.
these around there. I guess just as a final question, what would be one piece of advice for someone that's interested in getting into health technology or founding their own healthcare company? I know it's a bit of a cliche question, but I like to really ask this because it really is so important as entrepreneurs. It's
Sure.
hard to get started. It's hard to maintain and sustain. You've sustained now 2 years in telehealth specifically.
Yes.
Again, congrats. But I would
Thank
just
you.
love to get some insight for the listeners on your thought there about starting a health tech company.
Uh, First is you always have to look at what services you provide because you have to really provide a high quality services. It doesn't matter like what it would be. It could be anything, right? But if you're not providing something which is very specific and you know how to do it and you're expert in it, I don't say, and that should go along the way, not just only for telehealth. Any business that you would have to
Yeah,
start, you have to be really knowing and being an expert in the services that you will provide because there's tons of competitions out there. What's going to make you stand out is that you always make sure that you provide the best quality of services along the way, right?
incredible. Yeah,
Second, I would say don't go cheap on having a good system, a good EMR, a good case management uh, um, um, software that you can use. These things would really help you to optimize your business later on. Like, even if you have to pay a little bit more, if you have to pay a little bit for AI integration, these things at some point is going to help you way more than what you think. So it's a value that you're going to add to the business, even though it might be expensive in the beginning. But believe me, that's going to turn everything in the right way a year, 2 years, 3 years later on once you start getting even more bigger in the business itself.
long-term
And I
payoff.
would say
Yeah,
third and last one, which is always there, is to have a great team that you communicate your vision with them. Because if you're not communicating your goals, my team from day one, they know what was my goal from the beginning, what's my 3 years goals, what's my quarter goals. They know everything of where we're going and where we're heading to. So always get a team that can work along with you, and try to share your vision, try to share your goals with your team, so everyone is with you on the same page.
Amazing advice, Ali. Thank you so
Thank you.
much. Yeah, that's
Absolutely.
genuinely amazing advice. Well, ladies and gentlemen, real treat. Pleasure to have you on. And this is episode 3 of the Healthcare Growth Cycle podcast. We will see you on the next episode. Thanks a lot.